Hello, my name is Amber. I am the orthopedic nurse navigator for joint replacement here at UT Medical Center. Welcome to ankle replacement discharge class. You are non-weight bearing on the surgical foot after surgery. This means you cannot put any weight or pressure on that surgical foot while standing or sitting. Your surgeon will tell you when it is okay to begin bearing weight. Please avoid putting your surgical foot on the floor. Non-weight bearing after ankle replacement surgery has several benefits. If any weight is placed on the surgery foot, it can cause damage to the bone, the implant, and surrounding muscles and tissues. Adding weight too soon can interrupt internal healing or cause shifting, loosening, or breakage of the hardware. Optimal wound healing occurs when the surgery site is not stressed by weight. Non-weight bearing helps to reduce swelling, which helps tissues heal faster. Coughing and deep breathing after surgery is important to re-expand lungs and help prevent pneumonia. Take 10 slow, deep breaths and cough once an hour while awake. If there is not any issues with breathing, it is okay to stop using the breathing machine on post-op day 10. Antithrombolytic hose or compression stockings should be worn after surgery to help prevent blood clots and swelling. You may remove them for short breaks and then replace them. Please use them for at least 10 days after surgery. There will be minimal hands-on care for your surgical site. You will not remove the splint or bandages. Keep splint and bandage dry until your follow-up appointment with the surgeon. If there are any problems or issues with the splint and bandages, call the surgeon's office as soon as possible to let them know. Elevation is an excellent tool to help with pain and swelling after surgery. To get the best results, elevate the surgical side with toes above the level of your nose. Use 2 or more pillows and keep the surgical leg straight when elevating. Pain after surgery is expected and is typical. Make sure to take pain medications as directed. Do not take any anti-inflammatory medications such as ibuprofen, Motrin, Aleve, Advil, unless approved by the surgeon. Start over-the-counter stool softeners as soon as possible to help prevent constipation while taking the narcotic pain medicine. If you need medication refills, make sure to call the surgeon's office prior to running out of medicine. Another tip for pain management is to use over-the-counter Tylenol or acetaminophen, which is the generic name. You may wish to add the doses of Tylenol with the opioid pain pill, or you may alternate between the doses of the opioid pain pill. Make sure to not exceed more than 1,000 milligrams of Tylenol at a time, and do not take more than 3,000 milligrams in a 24-hour period. It is helpful to have your caregiver keep a list of medicines, the dosage, and time of day you are taking them. This will help you keep track of all your medications and prevent accidentally taking too much. Another great pain relief tool is ice. Ice helps reduce pain and swelling after surgery. There are different types of ice packs, and you can use whichever works best for you. The guideline for ice therapy is to use the ice pack for 20 minutes out of every hour, then give your incision area and the skin a chance to warm and the circulation to normalize before replacing the ice pack. Keep a clean towel or pillowcase between the ice pack and the surgical incision area as a barrier. Setting a timer is helpful to maximize ice therapy effectiveness. You will not be able to drive after surgery. You will need the permission from the surgeon to resume driving at the appropriate time. Do not drive while taking prescription pain medicine. These are some of the medications you may be given after surgery. Not every person will receive every medication. Some of them are as needed and some are prescribed by the surgeon. If you have questions about any medicines you are given, please ask your nurse or reach out to your surgeon's office. Constipation can be a common occurrence after surgery. There are several things you can do to help prevent or treat constipation. Getting up and increasing activity, drinking adequate amounts of water, eating a balanced diet with high-fiber foods, and using over-the-counter stool softeners and laxatives will help if you are constipated. Do not let more than 1 to 3 days pass without having a bowel movement after surgery. If you are having difficulty with constipation, please call the surgeon's office for recommendations, or you can reach out to the orthopedic nurse navigator. Preventing blood clots after surgery is very important. You will be prescribed a blood thinning medication to take after surgery for a specified amount of time by your surgeon. There are several things you can do to help prevent blood clots from forming. First, take your blood thinner medication as prescribed. Then, make sure you are getting up and moving. When you are sitting, pump your feet or ankles and stay well hydrated by drinking plenty of fluids that do not contain caffeine. You will want to prevent infection while you are healing from surgery. Always wash or sanitize your hands before touching any area around or near the surgery site. Monitor your surgical site and the skin around it for any signs or symptoms of infection. If there are pets in the home, do not allow them in the bed where you sleep or to lay near the surgical site. If you need a medication refill, call the surgeon's office during business hours. The surgeon's office will need 48 hours to process the request for refill of medicine. You can plan to call before you run out of medication. Please call the surgeon's office if you have any urgent problems. Reasons you may need to notify the office would be for a temperature greater than 102 or higher for greater than 24 hours, any infectious drainage from your surgical site, a dramatic increase in redness and warmth around the surgical site, new chest congestion, severe calf pain accompanied by increased swelling in legs, pain that is increasing even after taking pain medications, new dizziness or confusion, blood in stool or urine, and if you fall or injure the surgical foot. If you have loss of movement or blood flow in the toes or the foot. If urgent questions arise that cannot wait until the regular office hours, the surgeon's office has an answering service and a provider on call. Be prepared to give your name, date of birth, surgeon's name, and date and location of your surgery. The provider on call will get a notification of your question and will give a call back. If you experience any chest pain, trouble breathing, or shortness of breath, call 911 or go to the nearest emergency room. For successful recovery from surgery, make sure to keep all follow-up appointments, take medications as prescribed, be as active as possible, and eat healthy. Thank you from your healthcare team here at UT Medical Center for allowing us to be a part of your joint replacement journey.